All right, so I have my patient here. Patient is in the PACU now. I am the PACU nurse. I'm going to be getting a handoff information from the circulating nurse, obtaining any information about the surgery, how it went, how the patient tolerated it, the trend of vital signs during surgery, and any pertinent information about the surgical wound. And then in my mind making mental notes and writing out actual notes as well of how I'm going to prioritize my nursing care. So I have the report. The circulating nurse stated that the patient tolerated the patient really well, no complications, sent me the trend of the vital signs and they looked normal. And the surgical incision has stitches and should be looking okay. There's a little bit of redness, but that is normal after the surgery. Okay, so now I'm going to make sure that I establish first things an airway, patent airway for the patient, making sure that the patient is breathing. There's no depression in breathing, so I'm going to put on an oxygen mask and making sure that so I have orders here for oxygen to maintain SpO2 greater than 92%, so monitoring that value, and then so I have the established airway. The patient's breath looks like it's expanding equally. It is a little bit slow right now, but that is normal because the patient is coming off of anesthesia. And now I'm going to connect all of my monitoring equipment to the patient. So like ECG monitor, blood pressure monitor, heart rate, pulse oximeter, and so that I can be watching these things and monitoring them, making sure that they stay so obtaining like an initial baseline vital sign and making sure that they're not, they're not getting any worse and only getting better or staying about the same. So I have those things on and I'm just going to do a quick, so the patient right now is coming off of anesthesia, so I'm expecting the patient to be awake but a little bit drowsy. Okay, so I'm going to just perform a little bit pieces of the basic physical assessment. I've obtained baseline vital signs with my monitoring equipment. And so so Caitlin, do you know where you are right now? Yeah, I just came out of surgery, I believe, and I'm in the hospital. Do you know what time it is? No? Okay, so I say the patient is alert-oriented ×3. Like I said, drowsiness is to be expected, and just because of the anesthesia. All right, so just a couple things. If you could close and open your eyes. Close, open. Okay, pupils are reactive to light, round, and equal. And can you feel this on both sides? Okay, great. I'm going to be checking the skin turgor here, and if any edema on the arms, and the cap refill, making sure blood is being circulated. I'm going to be, checking the stomach area, just looking. I'm not going to touch just because that area is going to be really sensitive right now. And checking the incision, checking for any drainage. All right, so there's a little bit of drainage. I'm going to note that. It has a little, most of it is clear, a little tint of yellow. Okay, so the drainage that's pretty normal. It is red and a little inflamed. Okay, I'm gonna listen the lungs and the heart. Okay, S1 and S2 is present. Okay, lungs sound clear. Just gonna check the vowel sounds. Okay, so vowel sounds aren't as active right now, but that is pretty normal. Hopefully they will begin to be sounding a little more active after a while. So I'm going to be doing these quick assessments and checkups every 15 minutes until me and my other team members here of the unit feel as though that the patient is well oriented and is ready to move on to go down to the acute care setting. But right now, just monitoring those basic vital signs, monitoring for pain. So could you please tell me right now what kind of pain you're experiencing? Is 0 being no pain at all and 10 being the worst pain? Okay, so patient state's about a 7. So I do have pain medications. I'm going to go over the medications in a little bit. Just so, like I said, monitoring those vital signs, making sure, most importantly, that the patient is breathing, that there's a pad in your way. So I do have medications ordered. So the patient right now is NPO, so nothing by mouth. I have an IV LR, so that IV, I'm going to make sure that I'm checking the IV sites and that they're patent. So this LR is to, IV is to help replenish electrolytes, so I'm going to be administering that 150 milliliters an hour. Technically, in my scope of practice as a student nurse, I'm not able to give IV medications or insert IVs, but just for practices of the simulation, I would be administering that. I'm going to be putting on sequential compression devices. So I'm just going to be putting these on, Caitlin, for you. You were told in pre-op about deep vein thrombosis and the complications that can come from it. This is help to prevent that, and then it's just to help the overall blood flow of your body, okay? And then, so oxygen obviously is on. I have fentanyl here. So this is for the patient's pain. I'm going to give it initially, but it's a PRN, so as needed. So Caitlin, please let me know if you are experiencing excruciating pain and you think you need more pain medication or would like more pain medication. I can administer that every 5 to 15 minutes for you. I have Zofran for your nausea and vomiting. So right now, are you experiencing any nausea? Yeah, I feel definitely a little bit of nausea right now. Okay, so I will give you a Zofran, and this is, again, so let me know if you keep feeling that nausea, and I can administer you more as needed. And then I do have Narcan, so this is kind of something that I would be obviously monitoring the patient's respiratory rate. And right now, when I took the initial vital signs, I have it as a 10. So I would administer it if it goes below an 8. Okay, and then I have some pain or anxiety and restless medication that will help with anxiety and restlessness. So I will administer that initially, but let me know if you are, feeling overly anxious at any times. I'm your best advocate, so please ask me any questions or if you need anything. I have these orders and I can administer these medications as needed until you leave the unit here. So those are that. Like I said, I'm going to be monitoring the patient coming in every 15 minutes, assessing vital signs, and doing a quick little parts, bits and pieces of the physical assessment. making sure I'm checking the surgical incision, and just overall blood flow, and things like that. So, Caitlin, I've performed my 15-minute first. Let me know if you need anything right now. Here's your call it button if you need me before I come back shortly. And now I will go and so I believe that the surgeon is the first person that would tell the patient's family in the waiting room how the surgery went. But I am the patient's good source of patients as an advocate for the patient. So I will go down to the waiting room if I can and let the family know, answer any questions they may have, let them know that Caitlin is doing okay and we're monitoring everything right now. And then when we feel as though the time is appropriate and the patient is in good condition, we will then admit her to the acute care area. So I'll go ahead and do that. Caitlin, like I said, call button's here. Let me know if you need anything, and I'll be back shortly in 15 minutes, okay? All right, thank you. Thanks for watching.